Hello, my name is Monique Nowlin, and I'm your host for this episode of Our Ventura TV. Today, our special guest is Dr. Thomas Duncan, Chief of Staff and Trauma Medical Director for the Ventura County Medical Center, and he is here to talk to us about fall prevention and how older adults can stay active and engaged during the COVID-19 crisis. Dr. Duncan, welcome. Thanks for your time today.
Thanks for having me on your show, Monique.
Well, many of us have an image of growing older, and sometimes that image involves decreasing strength and decreasing ability to stay on our feet. Are falls a natural part of aging?
Well, contrary to the myth, falls are not a natural part of aging. Many people think it wouldn't happen to me, but the reality is that we all know someone who has taken a fall over the past year or a few years or few months. Either a relative or a friend or a co-worker or an associate has taken a fall. For example, my dad took a fall 7 years ago when he was 80 years old. He's now 87, and it's changed the entire dynamics of the family from him being independent to now being dependent on care 24/7. Data shows that once a person attains the gracious age of 65, falls tend to be common due to some preventable reasons. I'd like to emphasize the term preventable because most of these issues that cause falls are preventable. Some of the causes of falls are vision loss, for example, macular degeneration that occurs with aging, cataracts, which can be taken care of in a 5 to 10 minute operation, and it changes an individual's entire schema of life. Glaucoma, which is a silent blinder, hearing loss, loss of strength and balance due to non-use or being sedentary, and taking the duplication of medications. For example, an individual may see multiple healthcare providers from one visit to the other. Their medications are not reconciliated, and ultimately they end up being prescribed the same medication that they normally take, and it compounds the incidence of falls because these medications may interact with each other. Alcohol consumption. Now, some of us like drinking a glass of wine with dinner. Some like to drink a small glass of wine. Others drink a large glass of wine. So it alters one's perception and can ultimately lead to falling. Dementia also can cause falling because some individuals may wander away from home because they get confused and they trip and fall or get hit by a car, and ultimately leads to their demise. Now, having a hazardous living situation can also lead to falling, such as clutter in the hallway, poor lights, or not having enough night lights, unsecure throw rugs, or having warped rugs at the edges, or having hallway extension cords that can cause a tripping hazard. Now, some bathrooms are geared for the younger, and as we live in our homes and get older, the bathrooms may not be refurbished or made for the older individuals. And absent grab bars or low toilet stools and absent shower chairs could also cause an individual to fall. It's important to see a healthcare practitioner at least once a year or even twice a year to manage medications and potentially direct one about home health services.
Okay. Now, I know you've talked a lot about fall prevention and what someone can do to prevent falls, but tell me about the stats. I mean, should older adults and caregivers really be that concerned about falls? What are the stats?
Yes, older adults and their caregivers need to be concerned about falls because 1 in 4 individuals over the age of 65 will fall each year. And that number increases to about 50%. So 1 in 2 adults over the age of 80 will fall each year. Now, this equates to about 29 million falls per year. So as you can see, the number increases exponentially with age. Statistics show that our elderly population is increasing worldwide. The percentage for elderly will increase from a current number of about 11% to 20% in the year 2050. Every 11 seconds, an older adult is treated in an emergency room due to a fall. Now, this equates to about 3 million emergency room visits per year. 5 older adults die of a fall-related reason every hour. So every 20 minutes, an older adult dies due to a fall. And this number will increase to 7 deaths per hour in the year 2030. There are multiple fractures or injuries that occur with falls. At the top of the list is hip fractures. So 95% of hip fractures are caused by falling. And other injuries related to falls include facial fractures, brain bleeds, spine fractures, because when an individual falls and they fall backwards, they can injure their spine, or they have injuries to their arms or legs. For example, if somebody is falling, they normally stick their arm out to break the fall. And I was on call this past weekend and had to deal with some individuals that had these kind of injuries. Falls among older adults over the age of 65 are costly. They're very costly. Each year, the United States spends about $5 billion on non-fatal injuries. So these are injuries that do not necessarily cause a death. And $754 million is spent on fatal falls, those injuries that cause a death. For non-fatal falls, $29 billion is spent by Medicare in terms of these falls, while $12 billion is spent by private insurers or out-of-pocket individuals. And $9 billion is spent by Medicaid or the equivalent of Medi-Cal.
So it sounds like these falls for older adults are not only costly fiscally, but they're costly physically, with the ramifications of a fall and how an older adult can degenerate so quickly from that fall.
Exactly.
So tell me, can you give the audience some tips on how to ensure their home is safe from fall hazards or risks? You talked a little bit about that earlier, tripping hazards. Can you expound on that a little bit for our audience?
Sure. It's best to have a home assessment if you have the ability to do that. Mm-hmm. There are companies that can come out that specialize in home safety. These companies will go around the home, ensure that if things such as grab bars in the bathroom aren't available, they can be installed. Toilet seats can be elevated. If a shower chair is needed, that can be provided. If a ramp is needed because the individual either has a wheelchair or walks with an assisted device, they can install that. If there's stairs, they can recommend against having those stairs or other ways of getting around. If the bed is not at the appropriate height, they make recommendations about that also. If throw rugs aren't affixed to the floor, or if they're curling up on the edges, they can affix tape to them to prevent them from having individuals trip and fall over them. If the floors are not appropriate, such as if the floors are slippery, they'll make recommendations about that. Cabinets should be at the appropriate height. Otherwise, if an individual is reaching up too high, they can trip and fall, or if they have to stand on the stool to get to the appropriate cabinet, then ultimately they can fall. Also, they look at the hallways. If the hallways have clutter, they ensure that the hallways are free of clutter or extension cords and have appropriate lights. If there are night lights that can be installed in the hallways to provide adequate lighting to different parts of the home, such as the bathroom or the kitchen, it makes a big difference. Now, unfortunately, many people are resistant to relocating homes to a safer one. The reason being is they're emotionally attached to it, or do not have the financial fortitude to be able to relocate, or not aware of the dangers of the home that they used to be in that were appropriate for their younger years, but are not appropriate for their older years. So one of my suggestions is that people should be open-minded to move such that they can be in a safer environment.
Thank you for those tips, Dr. Duncan. And they're just great tips. So I, as an older adult or as a caregiver, can really make some meaningful change just with the few tips that you were able to provide us today. So I know you provide oversight for the fall prevention program housed at the Ventura County Area Agency on Aging. Can you tell me a little bit about the program, and do any of the services offered by the program cover anything that you've talked about tips-wise, home assessment-wise?
Sure. The injury prevention process begins in the field with the emergency medical services, and the program is piloted in the West County. Now, this program was created by a coalition formed in 2013 of approximately 30 community-based organizations, the EMS, trauma centers, Ventura County Medical Center and Los Robles Medical Center, and other non-trauma centers in Ventura County. And it is supported by the Board of Supervisors, which is great. After a 911 call, the EMS arrives at the home. They confirm as to whether or not the fall was due to the call was due to a true fall. They determine if the individual needs immediate transport to the emergency room, and or whether or not they need to be treated at home. And if they need to be transported to the emergency room, there's absolutely no delay, and they transport them to the emergency department, where the hospital manages the patient accordingly and ultimately conducts certain evidence-based tests when the individual arrives, if they're able to. Because obviously some individuals are so badly injured that they cannot undergo any further evidence-based testing, such as the timed up and go test, etc. Now, if the individual is not required to be transported to the emergency department because their injury is not severe and can be managed at home, the EMS make a quick assessment of the home, and they provide certain mitigation measures. They advise on dangers of clutter, of proper lighting, some of the things we've already spoken about, rugs, medication reconciliation, footwear. And they also leave fall prevention literature in the home for the individual and their caregivers if they are available. Now, a fall prevention coordinator, who is a licensed social worker whose base is located at the Ventura County Area Agency on Aging, eventually contacts the patient that fell from a database that is received on a daily basis to determine their needs. Some individuals may require referral to a primary care provider or need a vision check. And through the partnership of our public health department, we're able to make these referrals happen. Also, some may need a home evaluation or a referral to one of our evidence-based fall prevention classes or exercise classes organized by the Ventura County Area Agency on Aging. These classes have been tried and true, and they've been shown to decrease the amount of falling that happens. And individuals that does not necessarily have to fall first to be enrolled in the class. They can enroll before a fall to prevent a primary fall. These classes include Tai Wan Chi, or moving for better balance, walk with ease, stepping on, a matter of balance, to name a few. And these classes are run by trained volunteers. And as mentioned before, they seem to help. They seem to help the individuals maintain their balance. Now, the coalition normally provides 2 fall prevention awareness forums every year. One is predominantly in English, while the other is in Spanish and English. Now, unfortunately, the May forum that was supposed to happen last month was canceled due to the COVID-19 pandemic. The turnout is usually about 150 to 250, but could go up to as much as 300, all depending on the venue. And in addition to learning about dangers of falls, residents interact with many community-based organizations that have ideas and tools on how to keep elders safe. Now, one forum is conducted during the National Falls Awareness Week in September and starts off with a proclamation that is awarded coalition by the Board of Supervisors. And this has been ongoing for the past 7 years. And we truly appreciate the Board of Supervisors recognizing our Fall Prevention Coalition for the work that we do. We are attempting to reach every part of the county. For example, we've been to Ventura, we've been to Camarillo, Santa Paula, Oxnard, Simi Valley, and Thousand Oaks, to name a few. And we've held a total of 13 forums over the past several years. Now, the Ventura County Area Agency on Aging, particularly Monique and Victoria, have played an integral role in making the forum a success, in addition to our many community partners.
Very good. Now, Dr. Duncan, can you talk to us a little bit about the evidence-based exercise classes? I know with COVID-19, those classes can't be conducted. How can an older adult stay active while they're under stay-at-home orders or sheltering in place?
Well, there are a few things that can be done. For example, one needs to sit less and be up and about more so. So walk-in helps if you have the ability to. Walking around the home can get quite boring. So going out into the neighborhood, being socially distant can also be a good thing. But you have to be careful about sidewalks when you're walking around the neighborhood, because some of the sidewalks may be uneven, and these also can cause a fall. Pilates is a good exercise to do. Stretching, virtual exercise classes if you have the ability to sign on to those. dancing is also a good thing. My mom is 79 years old. She loves to dance, and I love the fact that even though she's 79, she can still squat and stand right up, and it takes me on, and sometimes we go at it when I visit. Gardening is a good thing to do. Strengthening exercises, and not necessarily picking up very heavy weights, but weights going from anywhere from 5 pounds to 10 pounds, and then arts and crafts.
Very good. Well, what's the best way for our viewers to contact the Ventura County Fall Prevention Program about the services if we want to hear a little bit more?
Well, the best way to contact the agency is by either dialing 805-477-7300. Once again, that's 805-477-7300, or going to the website, www.vcaaa.org or www.vcaaa.org.
Well, Dr. Duncan, thank you for your time. You've given us a lot of information. I have one more question for you. If there is one thing that you could impress upon our viewers, one salient point you can make, what would that one thing be?
That'll be that falls are largely preventable, and balance and exercise training will keep you upright such that you do not sustain an unnecessary life-changing injury.
Very good. Well, that's all the time we have left for today's show. I'd like to thank Dr. Duncan again for his time. I know you're very busy, so we're really grateful for the time. You've given us some amazing information for us that we can take back and literally immediately executable steps that we can do to make our homes safer today. My name is Monique Nowlin. I'm your host for today's episode of Ventura TV. And until next time, thanks for watching.